So these are the visual pathway defects. Now though you have read visual pathway defects so many times, but still we can get a quick recap of all these defects. So when we have defect in the optic nerve, whenever we are having the defect in the optic nerve, you can see we are having the total blindness on the side of lesion and there is normal. So there is total blindness here while we are having the normal vision here. Then bitemporal, you can see if I say this is temporal, just a second. This is temporal, this is nasal and nasal. So this is actually bitemporal. So this is bitemporal hemianopia. Bitemporal hemianopia. So if the temporal blindness is there, therefore which fibers will be affected? It is the nasal fibers. Therefore nasal fibers are affected. If the nasal fibers are affected, therefore it is a lesion of optic chiasma. Therefore, it is a lesion of optic chiasma. Next, you can see that same sides of both the eyes. This is the right eye field and this is the left eye field. So, right side, right side and left side. So, you can say that it is the left side of both the eyes which are getting affected. So, it is actually contralateral homonymous hemianopia. Contralateral homonymous hemianopia that you are going to get, and where you are getting this for the first time in the lesions of the optic tract. In the lesions of the optic tract, we are going to get this for the first time, and it is also the most common defect. Then after this level, be it the lateral geniculate body or be it the optic radiations or be it the visual cortex, you are going to get the same. But I told you just now that we can divide the lesions of the optic radiations. We can divide the lesions of the optic radiations into the two lobes. One is the pie in the sky, and we can divide this into the pie in the floor. So we have already talked about pie in the sky is ST. So this will be in the temporal lobe lesion, and pie in the floor, that is PI. So this will be found in the parietal lobe. This is found in the parietal lobe lesion, and then this is something here, central area is spared. So this is your contralateral homonymous hemianopia. Contralateral homonymous hemianopia along with the macular sparing. Very, very important. Now, why we are having this macular sparing? Macular sparing is actually due to the double blood supply. Because the macula is having the double blood supply. What is the double blood supply? The posterior cerebral artery along with the middle cerebral artery. So while the posterior cerebral artery continues to supply only the periphery, the middle cerebral artery will give both along with the posterior cerebral artery, both will give to the macula. So if this vision has gone also, middle cerebral artery will continue to supply the macula, and therefore we will continue to have vision, and therefore we will have the central sparing. So this area will continue to have vision. This is called as macular sparing. Very, very important. Okay.